Last month on Weekend Connection, we began a discussion concerning thyroid disorders and their various treatments and whether or not those treatments are effective. Today, we'll continue that discussion and consider that,
unfortunately, there is still a chance that even if the numbers are correct, that you can still have other manifestations of disease.
My name is Vic Gregory, and let's get connected. Last month on Weekend Connection, we began a discussion with Dr. David Kim. He is the Chief Operating Officer of Beacon Christian Community Health Center in Staten Island, New York. And Dr. Kim is a graduate of the State University of New York, Downstate College of Medicine, and has completed a combined dual residency in internal medicine and pediatrics at Staten Island University Hospital. He is actively involved in student and resident mentoring and is a sought-after conference speaker who addresses the importance of integrating faith, work, and life. And Dr. Kim, it is a joy to have you join us again today on Weekend Connection.
Well, thanks so much for having me back. It's definitely an honor and a pleasure.
Before we get back into our topic, which is thyroid disorders, I'd like you to do a little something for us, if you would, please.
Sure.
It's a bit intriguing reading your bio and seeing that you talk with conferences and individuals about integrating faith, work, and life in your treatment regimen. What exactly are you talking about when you are referring to those things?
Well, I think one thing that we have lost in the course of healthcare recently is that medicine is still fundamentally a relationship between the patient and the healthcare professional. For us as healthcare professionals, medicine is a way for God to work through us as part of his work of healing in this world, and it's a way for us as those who receive God's love to be able to share that love by being the hands and feet of Jesus when we take care of our patients. Mm-hmm. I try to teach and share the idea that this approach is particularly important when dealing with people who have physical, mental, emotional, relational, and spiritual needs, all of which are components of healthcare. And I have found through the years that both caretaker and caregiver, patient and physician alike, they all want to have hope. Right? They want to believe, patients want to believe in particular that they're not alone, that the providers are with them, on the road with them, fighting alongside them in that same hope to help them to get better. And so what I try to do is help people recognize that what they believe is incredibly important in determining how they look at life. And particularly as healthcare providers, what we believe is critically important as we share that perspective with patients, and hopefully in an optimistic and hopeful way.
In your practice there in Staten Island, you actually incorporate sharing the gospel and introducing people to the Lord Jesus Christ in your treatment plan, don't you?
We do, and we don't try to, in so many words, bash people on the head with a Bible every visit. But what we do is we apply, what we just talked about, taking care of their physical needs, taking care of their mental and emotional needs, helping patients to realize, and some do, that at the core of what they're dealing with, there's a spiritual problem. And through our counselors, through our staff, through our spiritual care team, we've really worked hard to create a comprehensive model where we address all these various aspects of a person's health, and in so doing, help people to realize that maybe there's a greater hope than just medicine or just counseling, that maybe there's a God behind all this that might actually care for them, and maybe, Lord willing, they'd learn about how he did so by coming down in the form of a man, Jesus Christ, who died for them. So that's really what we hope and pray for. And however far we get with each encounter towards that point, even if it's just a small baby step in that direction, we consider that a blessing.
That is an exciting sounding opportunity and ministry that you have there, and I commend you for what you're doing.
Thank you. Thanks so much.
Last time we were talking about thyroid disorders and some of the common side effects of thyroid disorders, and we were just beginning to touch on the treatment for these disorders. And we talked about the fact that there has been a recall of two very common medications that have been used to treat these disorders, levothyroxine and liothyronine. And you were discussing with us why the recalls had taken place. Can you go back over that, if you would, please?
Sure. In most cases, the recalls were of what we call natural thyroid medications. These are medications that use thyroid hormones obtained from pig or cow sources, and they're repackaged into consumable form by humans. Now, these formulations coming from animal thyroid glands, instead of being synthetically produced in a uniform fashion, historically have been notorious, honestly, for being difficult to obtain universal similarities in potency from dose batch to dose batch. And so in a couple of the cases, it seemed that the FDA pulled the product not so much because it was deemed unsafe, but because unlike synthetically made thyroid hormone products, the uniformity of the dose potency could not be maintained. So it was more of a consistency issue than anything else.
Okay. Now, as patients are making the switch to the synthetic medications as opposed to the medications that are derived from natural sources, are there a significant percentage of patients that are continuing to experience significant symptoms?
The change to synthetic thyroid does cause in certain patients, in certain percentages of patients, some ongoing difficulties with symptoms. You know, according to the National Institutes of Health in 2019, for hypothyroidism, even when TSH levels were controlled on synthetic thyroid hormone, it's estimated, because we don't know for sure, that about 5 to 10% of treated hypothyroid patients still have persistent symptoms. And there are various reasons for this. This can include differences in individual set points internally with their hormone control, coexistence of other autoimmune diseases or other diseases in general. And in some people, there's just a failure to appropriately convert T4 into T3, which is the active form of thyroid hormone, with these types of therapies. Now, for hyperthyroidism, again, even if treated by the numbers, so to speak, the effects of thyroid hormone excess or thyrotoxicosis can potentially actually be irreversible depending on how far down the road the person went before being treated. There's some data, for instance, that suggests that at least in patients, subset of patients who've had subtotal thyroidectomy, there's still an 8% persistence in the symptoms. So unfortunately, there is still a chance that even if the numbers are correct, that you can still have other manifestations of disease.
Well, my next question was going to be, how do you get those symptoms under control? You're saying that at least with a certain percentage, that's not going to be possible. With the rest of those who might be experiencing that kind of a problem, how do you get those thyroid-related symptoms under control?
Well, first and foremost, patients may need to follow with a specialist in endocrine or hormone-related diseases, an endocrinologist, to tease out some of the chemical factors I alluded to earlier that may be hindering full symptomatic recovery. There may be other tests needed that a healthcare professional should be ordering for other healthcare conditions whose symptoms may overlap with thyroid disorders, again, such as diabetes and other certain autoimmune disorders. And again, sometimes there may even be a need in some cases for counseling or even spiritual care to help patients sort of reset their expectations and find ways to be able to deal with the mental, emotional, and spiritual and physical aspects of their disease. So a complete support infrastructure and knowledge that you aren't going to go through this alone can be a huge difference maker. We've seen that many times over the years at Beacon for sure. And, people that I've run into that are dealing with not just thyroid, but other chronic health conditions have told me and have confirmed that, a well-rounded support team can make a huge difference in how to cope with the disease.
Dr. Kim, I have two questions concerning obtaining information. First of all, if individuals would like some information just in general about thyroid disorders and the proper treatment for those disorders, do you have resource information for them?
Personally, for myself, for patients, I find the Mayo Clinic's treatment of thyroid disease found at mayoclinic.org to be easy to read and still very comprehensive. I'll sometimes quick reference them and sometimes just give patients the web link as part of the way I help to guide them. In addition, the American Thyroid Association has a really good website think it's thyroid.org, that gives a lot of information for people who want to go a little bit more in depth about thyroid disorders.
All right. And we'll keep both of those on file, mayoclinic.org and the American Thyroid Disorder Association. I think that's what you referred to it as.
Yeah, it's the American Thyroid Association, okay. And the website is thyroid.org.
Thyroid.org. All righty. And here's my second question. You've talked about your model of treating patients there in Staten Island, New York, and maybe listeners might be interested. We have listeners all across the United States might be interested in whether or not there would be such a model, such a clinic that is faith-based and nonprofit in their area. Do you have a means by which they might be able to obtain that information and find out if they have such a clinic in their area?
Sure. Well, I always tell people, it's sort of an internal joke amongst our community, that our community of health centers, that when you've seen one Christian health center, you've seen one Christian health center, because each health center is geared towards working with the specific nuances and needs of their particular community. That being said, there's two organizations that, in different but collaborative ways, have tried to equip Christian doctors and health professionals across the country. The first is Christian Medical and Dental Associations, CMDA.org. They're a network of physicians all around the country, many of whom are still working in private practice. And again, they're all over the country. So if you go to the CMDA website, there's a way to look for a provider in your area. And then there's also Christian Community Health Fellowship, CCHF.org. They're a national organization of faith-based community health centers, and we're part of that also. And again, you can look through there to find a particular health center that's in your area. A lot of the health centers that are members work specifically with people who might lack the financial means to see, private doctors. A lot of these health centers are specifically geared to serve in underserved areas. So for people who might have difficulty accessing healthcare in your community, CCHF might be a resource for you.
All righty. Well, again, we'll keep those on file for our listeners, and they can call us here at BBN for that contact information. Dr. Kim, we're just about out of time. Before we go, is there anything regarding thyroid disorders or just treatment in general that you would like to share with our patients that we haven't already addressed?
I think one thing I wanted to reemphasize is that one mustn't lose hope. Whether it's thyroid disorders or whether it's diabetes or complications from cancer or heart disease, we know that as Christians that disease is going to be a part of who we are. At some point, we're all going to suffer from some kind of disease. Even, from old age, you'll still have some kind of condition because the body is not built to last forever. And I think especially for those of us who take care of people in the healthcare field, it's important that we continue to maintain that relationship with patients, with our community, because as we get old together, get sick together, the one thing that, especially in this day and age, that I have seen that people have really responded to is the idea that there's still hope. That even though the experts might say that there's a certain percentage of people that never get better, you don't have to be part of that percentage. And by the grace of God, if you find people who care about you enough to walk the road with you in the healthcare field, can become your partners in healthcare, it becomes a blessing for both us and patients when we can come together to glorify Him for the creations He's made us to be, flaws and all. And I really pray that whether it's thyroid disease or any other health condition, that we can all find providers to fight for us like that, and that as providers, we not lose heart and become weary in doing the good that we've been called to do in ministry of Jesus Christ to our people.
Amen. Well, Dr. Kim, it is a joy to talk with you today, and you have been a blessing to me, and I'm sure that you have been a blessing to our listeners. Thank you for joining us.
Oh, thank you, and God bless you and your ministry as well.
Thank you, brother. We've been talking with Dr. David Kim. He is the Chief Executive Officer of Beacon Christian Community Health Center in Staten Island, New York, and we've been discussing thyroid disorders, their impact, and their treatment. That's our broadcast, and next week we'll address another topic of interest for the Christian community on BBN's Weekend Connection.
Thank you for listening to this feature, a production of BBN, the Bible Broadcasting Network. BBN provides 24-hour Christian programming, great Christian music, and Bible teaching. Listen to BBN by clicking the link in the description.